Well, new here at 10, a local woman goes from an avid runner and weightlifter to not being able to stand for very long. And her story is one of about 150 people, all working with a Kansas City occupational therapist on long COVID since March of 2021.
I say I'm one step away from standing on the street corner talking about this because people don't know enough about it, and it does impact so many individuals.
And it may not be a street corner, but tonight KSHB 41's Megan Abundis is amplifying her and her patient's voice on the important work happening in long COVID recovery.
When people sort of ask, like, what are the things that have changed the most? It's like everything. The answer is everything. It's fine with me if running's not going to be a thing I do anymore. I would just like to be able to walk distances if we get back to that place.
For about 2 years, Sophie Day has lived with her long COVID diagnosis. But Sophie, she was an athlete, an ultra marathon runner.
So before I got sick, I was really active. I was cycling to and from work. I live in Midtown, I work downtown. I was traveling a ton for my job. I was a very avid runner. I was a weightlifter.
She and her husband, Jeremy, navigate this health journey together.
It was a very sparkling wedding. I didn't get to dance as much as I wanted to because of long COVID. I look pretty healthy. I mean, I'm in a wheelchair right now, but most of the time I am up and about. And if you saw me in public, you might assume that I'm a very able-bodied person.
Occupational therapist Jenna Hopkins is working to manage Sophie's fatigue.
This is something that's really difficult to rehab.
But the progress after a year proving successful.
Managing fatigue is one of the biggest things that we do.
More often than not, I was experiencing symptoms like migraines, headache, nausea, dizziness, really bad brain fog, debilitating fatigue. I needed to take a nap in the middle of the day every day in order to get through the day. I am now experiencing those symptoms far less often.
I think COVID for a lot of people has been life-altering. And I know that people are tired of talking about it. They're tired of talking about the mitigations for it. But this is continuing to impact people every single day.
Both say we need to continue the conversation.
For the people around them to validate them and believe them and support them.
In Kansas City, I'm Megan Abundis, KSHB 41 News.